Now I kind of want to switch gears and talk about what I think are some exciting things coming down the pipe, so to speak, and some exciting research that is ongoing. So the first study I want to talk about is a study that we just heard more about at our annual oncology meeting in June. And this study is called the Chrysalis-2, and it looks at the combination of two drugs called Amivantamab and Lazertinib in patients with EGFR mutant non-small cell lung cancer after they've progressed on the Osimertinib and platinum-based chemotherapy. So what Lazertinib is a drug very similar to Osimertinib. Lazertinib is also an EGFR TKI. It's very active against cancer that can go in the brain, and it seems to be very well tolerated in terms of its toxicities. What they did is also add another drug called Amivantamab, and that is kind of shown on the right. So what happens is Amivantamab binds to two different proteins, EGFR on the left and the green, and something called MET, which is in purple on the right. What we know is that MET is a way that cancer cells can become resistant to EGFR. And so now MET in this instance is acting like the on signal and kind of taking over what the EGFR was previously doing. So what Amivantamab is it binds to both of these proteins together, and that allows your body's immune system to recognize these cells as a problem and to eliminate them. Amivantamab is actually already approved in the United States for use in patients with a different type of EGFR mutation called an exon 20 insertion, for which Osimertinib and some of these other drugs we've been talking about are not shown to be effective. So what the researchers did is they took patients who have EGFR non-small cell lung cancer. All of these patients had to have received Osimertinib and had to have received platinum-based chemotherapy. And in some cases, other patients have received multiple different other drugs, other EGFR TKIs, and maybe even other chemotherapies. And everybody in this study received a combination of those two drugs, the Amivantamab and the Lazertinib. What they found here are some what I think are the interesting results. So when we look at the top line, we look at ORR, that means overall response rate. That showed 33%. And what that means is that about 33% of patients had a significant tumor shrinkage. I think the other really important piece of information for me is if you go down a little bit, there's an area that says stable disease. That means that for patients that their tumors maybe didn't shrink significantly or a lot, but it certainly didn't grow too much either. So it still means that the cancer is being controlled. And we see that another good proportion of patients had stable disease. So this drug combination seemed to do an excellent job of either controlling or shrinking the cancer. I think that here what they looked at was patients that had different prior treatments, and if maybe what their prior treatments, if that affected at all their response to the combination. And I really want to have you focus here on the dark gray bars. And these are patients who had received both Osimertinib, chemotherapy, and multiple other lines of treatment. And you'll see that even in that situation, they were included in the population of patients who had a good response. So that is below that dotted line that says -30. Those are the patients who would have considered to have an excellent response, meaning this combination was effective whether or not you had only a little bit of treatment before, or even if you had a lot of treatment before. Of course, it's always important to think about side effects, and side effects here highlighted in red are those that are related to the EGFR drug, the Lazertinib. So like we talked about already, rash, skin changes, diarrhea. There are side effects related to if you're targeting that MET protein. So that would be low protein levels, in your blood, and lower extremity swelling. And then I really want to highlight the side effect in green called infusion-related reactions. So this is a reaction to the drug Amivantamab. It's quite common, and patients commonly describe it as a sense of flushing. Some patients may feel warm, a little short of breath. They can feel their heart is racing. It's not considered a true allergy. This happens quite a bit with this specific class of drugs. And the great thing is that patients who then received either steroids or some other medications were able to then continue to go on to the drug, and the reaction did not recur.